Good morning. My name's Mark Starling, and I am a retired nurse who is wanting to introduce myself to you as a potential carer for your loved one. I have experience in a number of different clinical settings. I've looked after all sorts of medical conditions during my time. I'll give you a stat from the start to the finish. I initially worked within what at the time was called learning difficulties and qualified as a nurse in that area of practice. So I've looked after children, I've looked after adults with both challenging behaviour and with complex needs. I then moved into general, qualified as a general nurse, and then practiced pretty much within medicine. So I've looked after older people, young people with medical conditions. I also worked within the private sector for a number of years, running services for people with brain injury and spinal injury, dementia care, dementia with challenging behaviour, which was often in a hospital environment. So my experience is varied, and I have a lot of it. The job is purely about helping people reach their full potential, whatever area of work you're in. And it's also caring for people who are ill and giving them as much comfort and solace as you can. A little bit about me. I am, as I say, a retired nurse. I enjoy watching sport, playing sport, golf. Actually, I'm a bit old for anything more active than that. I also collect vinyl records. I collect coins, and I'm a bit of a petrol head. I like my cars. That's me. I'm hoping that I'll be able to meet some of you along the way. In the meantime, all the very best, and I hope you have a good Christmas. Bye bye.